Hey, it's Chris Byer.
It's Chris Bowling. What's up, CB?
ACB. We've got a special guest, Aadi with Hike Medical, joining us this morning in focus. Aadi, go ahead and introduce yourself. Tell us a little bit about your background, and we'll talk about Hike today.
Yeah, thanks for having me, Chris and Chris. My name's Adi. I'm a co-founder and CEO at Hike Medical. We're a startup focused on ending foot pain for blue-collar workforces in the United States. We work with employers of all sizes to, help
Yeah,
reduce lower extremity MSDs, prevent that foot pain from escalating into costlier and more painful injuries and disorders, and really focus on boosting morale and productivity, giving employees a benefit that they really want and can engage with. So that's what we do at Hike. And
that's
what
really
that
cool.
what that means in terms of the foot health is custom insoles. So we offer custom insoles in 5 minutes from home using any device rather than 2 to 3 doctors visits or
Yeah,
hundreds of dollars spent via health plan.
and I mean, it's just again, it's a product that I know so many people working on their feet. They're going to go buy something at the store, or and they're going to go through those quickly, or they're going to spend like I've done. I know Chris and I've talked about this for my athletic days. I've had insoles always remade, 3 visits, lots of money. You're using technology just to speed that up and make it more accessible and less costly.
Yeah, no. The traditional method to get a custom insole, and this kind of ties back to the background on actually how this company started. So my
Yeah,
family's been doing orthotics and prosthetics for, 60, 70 years, starting with my grandpa in India. And as a kid, I used to go sit in the lab all day in the summer and see, what my grandpa was doing and doing these custom orthotics. Then,
yeah,
my father does the same thing here in the US. And I kind of observed that they're doing a lot of the similar techniques that I've been seeing for the last 15 years, over in India.
yep,
And that didn't particularly make sense to me just because of the level of technological advancement that every other industry has seen, over the last
yeah,
10, 15 years in the time that, I really grew up. And so I knew there had to be a better way. So with Hike, the way that we do custom insoles, essentially people upload two 30-second videos of their feet, right? They take 2 videos either side of their feet. They upload it, and we've built proprietary AI deep learning algorithms that first turn the 2D videos into 3D models. And the reason why we do 2D
that's
video
so cool.
is for accessibility. Not everyone has the latest and greatest iPhone, as you know,
Yeah,
and everyone has access to a LiDAR sensor and all these other things. So we had to have natural video. We process that,
right.
analyze it, and then we design the custom insoles. And then, the cool part is what allows us to offer it to employers at such an accessible cost is we actually 3D print the insoles right here in Illinois.
It's great.
And,
Yeah.
yeah, so our entire kind of end-to-end supply chain and product started at Hike and ends at Hike. So that's kind of what allows us to do what we do.
No, it's so cool. And then for you to again decide to start this up in the middle of central Illinois in Peoria, I think that's also a cool thing too, is
Right.
you could have been anywhere in the country, but to be able to do something from this level of technology, I think that's just it's awesome to see that for our local communities.
Thank you. Yeah. Go ahead.
I was going to say, so when you're working with employers, Chris and I are talking through all kinds of ideas for, employee benefits. And as we've talked through this so many times, it doesn't always have to be the insurance or it doesn't always have to be the health plan. It's what are we doing to make our employers healthier and give them more options? So how do you engage with an employer when you do this? Because right now you're not really doing this direct to consumer. It is through employers as a benefit or a safety program, right?
Yeah. Typically, we work directly with employers, and usually the way we do that, there's a couple different avenues that they can take. Sometimes the employers will say, "Hey, we'll cover 100% for everybody," and it's really eat what you
Yep.
kill model. Whoever engages and activates, that's who they cover, and we're actually okay with that because at Hike we have double the national opt-in benefits enrollment rate on average
Wow.
across our customers, and that's a big problem that I've seen in digital health. Lots of solutions out there,
Yes.
not
Yeah.
enough people are using them. I think part of it's that we actually have a physical product. It's extremely personalized, and it's something that folks, especially in our target market, are already using.
Yeah.
These are things that
Right.
people are already going to the store and spending 50, $60 on a pair of Dr. Scholl's 3, 4 times a year. So, even if the employer covers, back to the employer question, even if the employer covers, 50 or 75% of the cost, this is
Yeah.
still an extremely viable benefit because these people really need the relief on their feet.
Yes.
Yeah, I think. Well, I know, Chris. We've got a couple of our clients already. 'Cause, using this as a benefit. We've got several that are being introduced to it. And I know, Aadi, you talked about it being mainly for blue collar, but I know we've had some conversations with employers that, in banking or financial services where you've got tellers on their feet, there's an interest level beyond that. So, I mean, I think it's just people are always active on their feet. This is something they're going to use. I think it's made so much sense for us to start introducing this to the clients.
Yeah, absolutely. And it can be positioned in so many different ways, as you said. It doesn't just have to be blue collar workforces, but this is truly a wellness benefit. And
Mm-hmm.
at the price point at which we're able to do it due to our AI and 3D printing technologies, it's really kind of a no-brainer. And that's what I tell employers. Our pricing model, we don't have any crazy PEPMs, and you pay us for stuff that you don't use. Our pricing model is simple. It's called no-brainer pricing. 0.3% of
it's
the
simple.
average blue-collar monthly wage per year.
It is so simple, and I challenge any employer out there that's paying for all of this, a portion of this, look at your spend. Because when we sat down with Aadi and he just evaluated one of our clients' spend, it was literally he could do it for a third, and I believe have a better product. I can't tell you how many employees that we are paying for, and they get they spend $400 to $600 on these things, and then they get them back. They're like, I don't like it, and now the provider's not willing to redo it because they want me to pay more. And once again, I'm blown away of how creative, innovative you are. You speak a lot higher than your age, which is amazing. We need more people like you that are going to help this country move forward. And I can't say enough how impressed we are.
Thank you so much.
Incredible.
And thank you. And you guys have been
go ahead. Sorry.
No, I was just saying, you guys have been super supportive, and we really appreciate that. Chris, I still remember that first phone call and the no voicemail box. So we've learned a lot working with you guys as well.
Well, we don't want to compare brain power because you're way beyond me, but I can't help with the little bitty things, right?
Absolutely.
Oh, that's cool. So, Aadi, I would ask a question too. I just got my feet scanned last week. I think as we're recording this, I should have mine insoles showing up in the mail today. But what are some of the results that you're seeing? It's great to be able to talk to this, but is there a way that you can say, all right, we've seen this success for an employee, or what types of outcomes are you seeing? Because I know what it's like to not have insoles and how bad my feet are, and I can speak to that. But somebody that's never used them before, what did they experience?
Yeah, there's a broad variety of experiences. It really depends on that person's prior history. But I'll give you an example of someone actually at one of your clients. So Todd at Morton Industries. We were working on pitching to Morton Industries. We sat in the room, and he was brought in. He's a team lead on the floor, and he said, "Put your money where your mouth is. Let us try the insoles first." So Todd had a pinched nerve and knee pain, and his foot started hurting, so he started walking differently. And so his knee started hurting, right? Because the pressure is being distributed incorrectly. So we scanned Todd's feet. We got him a pair of custom insoles. And prior, he actually had spent $350 with a podiatrist. Morton Industries had to pay some of that cost as well. And those insoles didn't really do anything for him. And 2 weeks later, I actually got a call, and it wasn't even from Todd. It was from the team over at Morton. They said, how can we kind of move forward? And I remember working with Chris, because Todd, his pinched nerve, we were able to kind of notice that, and we put the right pinched nerve pad there, right? This is a truly custom product serving the needs of each individual person, right? We're not trying to overgeneralize or technological leveling, as some people call it. That's not what we're doing here. So really personalized support. So we were able to disperse that pressure from the pinched nerve. Todd's able to walk normally again. He was jumping on the trampoline with his grandkids at Elevate, which is a large trampoline park. These kinds of things that he hasn't done in years, he's doing now. Other things, one of our other employers, we know verifiably we've prevented 2 workman's compensation cases from happening already. And that's just from people we've talked to. And right now we currently have a couple active studies going on. One thing we're doing at Hike, we're going to be publishing a live dashboard with our outcomes data, because we're connecting these Whoop bracelets with people who participate in our study. So we're not going to be publishing a bunch of case studies. We're just going to have a live dashboard that employers can go see how we're doing anytime.
Love it.
That's really cool.
Amazing.
Well, Chris, as we finish up, I know you've got one more question you like to ask.
Aadi, man, You've had that day. You got that call from me. I'm like, why don't you have a voicemail box when you are this amazing? Do you have a quote? Do you have a motto? Do you have something that just gets you through that tough day?
Yeah, I think especially for the current context, time where we're at right now as a company, it's do things that don't scale. Said by Paul Graham, he's the founder of Y Combinator. Basically, I think that's really what allows us to kind of have those high engagement rates, is because early on we did a lot of things that didn't scale. I spent 50 hours in 1 week at a bus facility talking to users. We consistently do things like that. And so, yeah, do things that don't scale. That's kind of the justification to do things that maybe not as appealing on the day to day and things like that.
Love it.
Well said. Well
Well
said. Well,
said.
thank you again for joining us. We're excited to see how Hike continues to develop. It's been really cool.
Absolutely.
Thanks, Aadi.
Yeah, thanks for having me, guys.
Good to see you.